Hi, this is Dr. Duresti with the Cranial Release Technique, and I've been getting a lot of questions, comments to could I give a brief review of the Cranial Release Technique? What is it? Why it's so important? Why do I feel it's so important? So let's go back to the beginnings here. We have a cranium, which is made of 22 separate bones. This obviously is a plastic model showing the different bones. And those 22 bones never fuse together. They stay separate. It was an American osteopath by the name of Dr. William Sutherland who about 100 years ago discovered the reason why those bones never fuse is because they need to move. And this is a Hoberman sphere. This is what I like to use to describe the movement of the cranium, the skull, to both practitioners and patients, to explain to them how this is a breathing, moving, dynamic system. And anything that causes the bones to shift, to twist, to close, and restrict that movement is a negative impact on the central nervous system, the brain, the spinal cord, and therefore will negatively impact the overall function of your body. So we can take this all the way back to the beginning, to the birth process. So here's a plastic model of a fetal skull, and during a normal delivery, the head starts to pass through mom's birth canal, and as the head's passing through, the baby's cranium is getting compressed. Compression, compression, compression. When the head exits, now we have expansion, and that kickstarts what Dr. Sutherland again called the primary respiratory mechanism. So here we have the baby's head coming through the birth canal, compression, compression, compression. The head exits, it blows open, and that kickstarts the mechanism. That primary respiratory mechanism, this dynamic breathing mechanism, should now stay with us from the time we're born until the time we depart this planet. Unfortunately, research has shown that when we're under physical stress, chemical stress, emotional stress, or even the constant chronic low-level stress that you're not aware of, things at work, things at home, things in the relationship, things with the finances, things with your health, things with your ability to play sports, the stresses that we all think of and try to deal with every day, that constant little gnawing away of the stresses also affects the cranium. So why do I have cranial release technique done on a regular basis? Because I want my body to function optimally. At 62, I want these bones to move as best as they can. I would have liked to have started when I was 50. Better would have been at 40. Better would have been at 30. And you can see all the way down the line. The best time really to begin cranial release technique is right after the birth process. So if you were my patient back when I was in practice in New York and you were pregnant, I would have educated you so that when the baby was born, you would be bringing the baby in as early as possible for me to start cranial release technique on the baby. Keep in mind, I also would have been working on mommy while she was pregnant. We want to keep mommy's cranium balanced, mommy's spine balanced, mommy's nervous system balanced, for the best and healthiest delivery. If you take that back another step, I would have liked to have sit with mom and dad before conception, explain the concept of the cranial release technique, explain the importance of cranial function and cranial movement through overall health. Then when mom becomes pregnant, she gets the best quality sperm from dad. She has the best quality environment and eggs that's already been there, we know, but the best environment because she's been under regular cranial care. And then throughout the whole pregnancy, they both come in on a regular basis. The baby's born, baby comes in for regular CRT, cranial release technique, and that's how you change families one at a time, happier, healthier, better people. Better people because the brain is now fully connected to the body. That's cranial release technique. That's the importance of this. That's why I will have this, and my family members and friends will have cranial release technique done for as long as we're on this planet, because we want to do one thing. We want to optimize function, and that's what it's all about. Sure, you have to eat right. Sure, you should exercise. Sure, you should get proper rest. Sure, you should go out in the sunshine. You should do all the things. You should be having fun. But to me, the principal cornerstone, the foundation of all this is cranial release technique. For those of you that are in practice and you'd like to learn more about the cranial release technique, you can go to my website, cranialrelease.com. There's a button there that says online training program. You can watch some additional videos, and you can learn how to do this in the comfort of your home or office. The beauty of the cranial release technique, it literally takes 1 minute to achieve. So you can do it in conjunction with your chiropractic adjustment. You can do it in conjunction with your massage, in conjunction with your acupuncture, in conjunction with your dentistry, in conjunction with your physical therapy, your occupational therapy, your speech therapy, whatever it is that you do. If you would add the cranial release technique to what you're currently doing, all your results, I've seen it over and over, will just get better and better and better. If you're not a practitioner and you're out there looking for someone, hey, I'd like to experience cranial release, visit my website, cranialrelease.com. There's a button there called Find a Practitioner, and you can search, and hopefully we have somebody in your area or your state that does the cranial release technique. Again, this is Dr. Duresti with the cranial release technique, the website cranialrelease.com, and I hope to see you soon. Dr. Duresti saying over and out, my friends. Adios. Until next time, be well. Cheers.